It should be, yeah, it's live.
Yeah, there we are, perfect, thank you. Hello everyone, welcome to today's public session of the Oversight and Engagement Board for the 12th of November. The time is about 10:07, sorry for the slight delay in starting. The minutes, I'm going to come straight to the minutes from the previous meeting, which was the 5th of November. I'm going to assume that everyone is happy with those minutes, unless somebody puts their hand up and tells me otherwise. So we'll sign those off. Thank you very much. We come to the next item, which is the summary of the local surveillance data. And I come to Lucy Whiteman, our Director of Public Health, to run us through that. Hi, Lucy.
Thank you, and good morning to everybody. So this is last week's surveillance report, and people will remember this is published on a Friday, so there is a refreshed version that will be published tomorrow on the Northamptonshire County Council website. But this is the week up to the 1st of November, so obviously people will recognise that this was the week that we went into the new national restrictions. And this was also the week that we had, again, more than 1,000 cases in Northamptonshire of COVID-19. And that continues to put pressure on our local NHS services. So we're continuing, obviously, to implore that people adhere to that new guidance, those restrictions, and that we try and utilise this 4-week period to try and bend the trend locally. A lot of other areas that were in higher tiers had already started to see their numbers go down. We've entered this period with still a very significantly increasing trend, and therefore we have got to use this period of time to try and get back on top of the position locally. So if we go to the next slide. So this just gives us a quick summary of what the new restrictions are. Obviously, people are only to leave home for essential reasons, and those essential reasons are primarily to obviously get food, medication, to go to essential work if you cannot work from home, to obviously attend school or college as they are remaining open. But obviously the key measures for reducing any onward transmission remain that you wash your hands frequently and for a minimum of 20 seconds at a time. You cover your face whenever you are in a small enclosed space or at risk of having to be in closer contact with somebody than 2 meters. And obviously wherever possible, you just maintain that 2-meter gap, be that within the home. If you've got a case within the home, trying to make sure that they isolate away from the rest of the family. When you're obviously out in public, obviously maintaining that space away from other people in the community. So again, we've provided links to frequently asked questions and to that exact guidance for people to follow. On the next slide, we are just, apologies, not on our side this morning, IT. Again, summarising what we're doing and making sure that obviously those new restrictions are enforced. They have come with new regulations as of the 5th of November. And obviously that means that a number of outlets have closed again, mostly food and drink and non-essential shop outlets, gyms, grassroots sports, etc. So significant restrictions, but obviously the difference this time being that schools and colleges remain open. The police are obviously working with our environmental health officers to ensure that these new regulations are enforced, and we are obviously trying to make sure that we are constantly reminding people of those restrictions and obviously why they're there. This is not, something that we would want to do. This is unfortunately a measure that the Prime Minister felt we had to take because of the situation and because of the increasing trend at a national level, but also reflected locally in COVID-19 cases. The next page then takes us to the data. So in the week up to the 1st of November, we've had another increase on the previous week and had 1,039 cases. This last week looks like we've had an increase further on that. So this is a continued upward trend in COVID-19 infection in Northamptonshire. We're obviously now at over 9,000 cases overall since the beginning of the pandemic. And sadly, I'm expecting, as I said, those figures to continue to increase this week. We are likely to obviously have a lag before we see the impact of the additional restrictions from the lockdown. But obviously at the moment, it is a very stark picture locally. And we are, again, obviously just reminding people of those sensible steps to be taken to make sure that they reduce the onward risk of infection. The next page just gives a breakdown by borough and district. So it doesn't, it gives a breakdown by gender and by age group, apologies. And one of the things that we've talked about in the last few weeks is, yes, we saw that initial increase when schools returned of cases in 10 to 19 and 20 to 29-year-olds. But now you can really see how that's starting to filter through the rest of the age groups. We've got a female bias in testing and positivity. And then obviously we've got that increase in the older age group, 40 to 49-year-olds, 50 to 59-year-olds, and still that worrying trend around the 60 to 69-year-olds. So if we go on to the next page, which is a breakdown by borough and district. Again, you can see broadly as a county, we've increased from the previous week. A couple of boroughs and districts have seen a small decrease in the number of cases, which is positive, but sadly the trend remains. And because people don't remain within those boroughs and districts, obviously the risk of transmission, even in areas where you've seen a small drop in cases from the previous week, remains. A large number of cases obviously continue to arise in our most densely populated area of Northampton, but again, it's a stark picture across the piece with more than 60 cases in every borough and district. So it gives you an idea. With one of the statistics here is that the Northamptonshire's total cases are more than 5 times higher than the average of the weekly totals seen between August and September. So it really is a step change in infection locally and a significantly increased risk for every resident within Northamptonshire. If we compare the rates on the next slide, this just makes comparison between the different areas easier because it takes into account the different sizes in the population. So Northampton and East Northamptonshire now have a statistically significantly higher rate than the county average. And we can see that nearly all areas now have a rate of nearly 100 or over 100 per 100,000 as a rolling 7-day average. So Northampton having the highest case rate at the moment, but very closely followed by East Northamptonshire. If we go down to the next slide. So overall increasing trend, we've talked before about the fact that Northamptonshire is starting to catch up with the national average line. And sadly, this last week, which you'll see in the publication tomorrow, that difference has decreased even further. So our case rate increase is now higher than the England average. And that's the real concern. Other areas, yes, we've started to see case numbers go down, but that's because they've had these additional restrictions in place for a number of weeks. Northampton is now playing catch up from a point of view of the trend. And, we do not want to be in a position where we start to meet that England average or exceed it. So there's a lot of work to do in these next few weeks. If we go on to the next slide. So from a point of view of the status around our educational settings, we've got 33 active outbreaks within schools and colleges and 188 cases associated with those. So we know that's because of the way that the bubbles work, etc. People obviously are working in close proximity, so you tend to see a number of cases every time there is an outbreak. The number of university cases for the week between the 26th and the 1st of November was 14, and that covers both their student and their staff base. So 100% of schools remain open, which is good news coming out of half term. Around 92% of pupils are attending as compared to 94% at the same point last year. So it's really impressive that schools are managing the risk that it will be continuous and ongoing, and obviously trying to protect students so that they're working in bubbles, and bubbles are excluded at any one time if indeed an exposure has actually occurred. So a good pattern, and we're hoping to obviously see improvements in that pupil attendance going forward. The next slide, please. So if we go down to the outbreak position, obviously people can have a look at the case rates by community and crude case numbers for each of the areas as we go through, but you can see it's a pattern across the county as we've talked about. And at the moment, at this point in time, on the 1st of November, we had 80 outbreaks that we were actively managing. There has been a small decrease in the last week, I'm pleased to say, but still nowhere near enough for us to be complacent. Again, you can see a lot of those outbreaks at that point were associated with educational settings, but we've seen an increase in the last week in the number of outbreaks that are on workplaces. And they obviously, a number of those will continue to be open throughout the lockdown. So we do need to make sure that all of that good practice is maintained both within the employment setting, but also that people take that best practice home again and don't leave the COVID secure measures at the door when they leave work. If we go down again, please. So flu is a slightly better picture. We obviously are encouraging that wider cohort this year to get a flu vaccination. Our target is always 75% of our eligible population. We've clearly got some way to go. We're still in the early stages of the flu season. But again, one of the areas that we're still dropping and falling short on is pregnant women and young children. So again, we're just encouraging anybody who's got a small child who's eligible, or if you're pregnant, to obviously seek vaccination as soon as possible. It's important, obviously, we maintain that level of protection from flu, both from a point of view of individual risk, but also from a point of view of protecting our NHS services. So please do, if you get your letter and get invited for a flu vaccination, please do attend. The last couple of pages obviously just give a summary of the work that we're doing and links to financial support and guidance for the lockdown period. So if I stop there, Councillor Morrison, I'm happy to take any questions.
Thank you very much, Lucy. A very good summary, as always, of the position we find ourselves in. I'm looking around the room. There don't appear to be any questions, in which case we can move straight on to the next item, which is testing update and then the contact tracing update. Now, I believe Sharon isn't here today, Lucy, so are you taking both those items? Do you want to take them together as they're together anyway? So carry on.
I'm happy to. So I'm really pleased to report that we're actually maintaining good testing levels across the county. There have been some boroughs and districts where testing attendance had fallen, but we're maintaining a good average of above 300 tests per 100,000 populations, a rolling 7-day average across all of our boroughs and districts, which is really positive. And it's, as we know from previous periods when we've been on the Chief Medical Officer's watch list, the best way to beat COVID is to know where it is and then make sure that that case is isolated so that the onward transmission is broken. From a point of view of operationally, all our mobile testing units, the two that we've got in the county, are operational. One is in East Northants in Nen Park, and one is in Daventry at Wilton Mill. We are commencing prison testing in the same way that we do with care homes soon, and obviously we've got prisons within the county. So the local adult prison process is on track to commence on the 4th of November. And the lateral flow devices, which is a new testing device, which gives you a very rapid turnaround from a point of view of a result, is being tested with acute hospital staff and commences in care homes soon as well. So guidance has come out, but we're just awaiting the kits to get that up and running. And we're utilising a similar approach with the universities, and we're hoping to obviously be ready at the end of November so that we can start to roll the lateral flow device testing out to ensure that people are aware of their status before they go home for the Christmas break, and obviously are able to isolate within the university setting if they need to before they return home. So lots and lots of testing plans in place from a point of view of high risk categories. So good news there. From a point of view of the update for contact tracing, we have got good news again. People will remember that obviously we've got our local contact tracing service, which complements the national one. Obviously that partnership is at the moment maintaining us at a point of around 83% of cases being followed up between the two services. And obviously historically people will remember when we took that on, the national service was only managing to follow up 69% of the local cases. So that continues to be a good news story, and we're managing to maintain that position. Obviously, our ambition would be to increase it further and make sure that we reach out to all cases. And again, just want to take the opportunity to ask people if they are contacted either by the national system or by the local system to please engage. We don't want the data for any other reason than making sure that we can protect the people who potentially will have been exposed to the virus. We are dealing with more cases. We take around 30% of all of the cases that are identified to follow up. The National Service does around 70% of them, but because we're seeing an increase in the number of cases each week, clearly that's starting to mean that we are much, much busier locally. So we're making sure we've got enough staff and enough support to continue to manage those increased numbers. The one last thing to add is that we understand that the new approach that nationally has been introduced, where when people are notified of being a case, they're given a link which remains open for 8 hours so that they can actually do their own, fill in all their own contact tracing details on a web form, has been very successful, particularly with younger cases. So again, that's starting to enable people to fill in that information rather than having to go through a longer phone call, but it gives them a bit more control as well. So that seems to have been a bit of a hit, and again, is just helping us make sure that we continue to follow up as many people as possible.
Thank you very much, Lucy. I've got a couple of questions for you. The first one I was going to ask was great news about the rapid testing. Is this the same rapid testing that was rolled out in where was it? Leicester? Where did it? Liverpool? Yes. Liverpool. Are they planning? Is that planned for the whole county? I know you're referring to the schools and universities and health settings, but is there a plan for that to be rolled out across the county? I didn't want to put you on the spot, but it's brilliant news, so we should highlight it.
It is brilliant news. So people are aware this is a slightly different test to the PCR test. It's still very effective, but it is still in part sort of in pilot phase. So it's a salivary test. Again, people swab nose and throat, and they then, almost very similar to a pregnancy test, they then put a contrast with it, a kind of an agent with it, a reactive agent, and within 20 minutes it gives you a result. It tells you whether the test has worked, firstly, and then if you get 2 lines, it tells you whether you are COVID positive. The current requirement is that you then, if you are positive, have a PCR test as well. And that in part is obviously to make sure, because we're still testing the efficacy of the lateral flow devices, to make sure that it is not a false positive, but then also it means that that person's results and details get uploaded into the system for the contact tracing as well. So that process will be condensed over time as confidence in the lateral flow devices increases. We put an expression of interest in locally to have it rolled out on a wider geography, not necessarily at a county level, because obviously there is a limited number of tests available, but we did put an expression of interest in. Unfortunately, we weren't chosen to be one of the first areas to roll that out. Liverpool is obviously one of the areas that's got it for the whole population, but a number of others, around 60 other local authorities, have been given a limited number of lateral flow devices for particular cohorts within their communities. So again, we're working this week with the national team to see if there's an opportunity for us to be in that second wave. But it is, as you say, the approach that's being taken with students, and we're awaiting the delivery for the University of Northampton, who have undertaken significant preparations ready for that, and obviously are aware of the fact that that will require them to continue to support some students who may be positive and may be needing to self-isolate before they return home. So timing's very key. As I said, we've expressed an interest, sadly weren't successful the first time around, but looking to engage with that process going forward.
Thank you, Lucy. Nonetheless, brilliant news, and to get that going from a standstill position across the country is very impressive, I have to say. So we look forward to hearing more about that. I've got Chris Lofts with the question. Chris.
Thank you, Ian. A couple of weeks ago, we debated whether or not we would voluntarily move up a tier within what were the criteria at the time. And given the surveillance data, the testing data, the positivity rates, do you think, Lucy, that we would now be facing being forced into the next tier if it wasn't for the national lockdown?
Thank you, Councillor Lofts. I think knowing what we knew, which wasn't definitive, I'll be honest, about the thresholds for the different tiers, yes, we certainly would be in a position where we would be considered to be tier 2 now. What we do know is that the government are reviewing that whole tiered process during the lockdown, and we await guidance as to what the decisions will be and the thresholds will be as we come out the other side. But yes, from a point of view of what we understand and what the Joint Biosecurity Centre were outlining as the thresholds for tier 2 prior to lockdown, we certainly have hit a number of those markers during this period. We do know, as I've said before, that a lot of the other areas that were already in tier 2 or tier 3 had started to see a decrease in cases. So there was evidence that, you know, restrictions were actually taking effect and making an impact. Our issue is that we hadn't taken that step before lockdown. So we've gone into lockdown on an upward trend, and it will take a couple of weeks for us to see the effect of the lockdown. We've just got to hope that people are adherent enough and responsible enough to take this as seriously as possible over the next 4 weeks, so that we not only bend the trend locally in this 4-week period, but that it decreases enough for us to maintain a level 1 situation as we come out.
Thank you very much, Lucy, and we would all agree with that, definitely. Just because the lockdown ends doesn't mean the restrictions will end. We just don't know what form they will be in yet. So there is a longer journey still beyond this lockdown. It's just a question of how long and all the other stuff with vaccination and everything else that's going on at the moment. So thank you for that question, Chris, and thank you for the answer, Lucy. I'm going to move on to Claire Hughes now for a comms update. Claire, hi.
Good morning. Okay. Yes, as we've seen from the trends that Lucy has already shared and discussed, our key messages continue to be around reducing the risk of transmission. So we're continuing to promote information and updates and signposting to how people can get tested and to encourage them to get tested even during lockdown. Also, for those that are having to self-isolate, again, supporting them through information on how to get help. And we're currently looking as well, because we do appreciate that lockdown's not a fun, self-isolation isn't a fun activity, and particularly when you've got young children, young people. So we're looking at developing some specific support packs, potentially things like advent calendars, to just try and give them a little bit more interesting activities to do during lockdown. We're also looking at continuing our general advice in terms of reducing transmission. We do realise that there is still, the trend is increasing. With lockdown, that would suggest that there's some transmission happening, obviously, in workplaces. We've got outbreaks in workplaces, and there's transport to and from home to workplace. So we're looking at putting outside signage, digital signage, reminders on backs of buses and inside buses for people to wear their masks, to keep their distances and to wash their hands regularly and undertake sort of social distancing and safe behaviour. Other preparation we're doing in terms of comms for the winter support packages that will be available, and from our media and social media, we're trying to do proactive messaging around flu, information and signposting for the extremely clinically vulnerable. So there's further information on our website, and again, we've been readapting our pages on our website to make it easier to navigate and find information around all sort of information related to COVID-19. We're still continuing to work closely with our partners. University has sort of offered some outdoor spaces for us to use to help promote messages using banners. And we're also working with our social impact sales, part of our operations team here, to identify and work with community leaders, champions and influencers for those harder to reach audiences. And that will lead into sort of translated materials and particular use of different channels. And again, just that obviously coming over into the future, we're going to be talking about vaccination programme, and we'll be doing rollout communication with our NHSE colleagues. I think that's probably about it.
Thank you very much, Claire, as always, and as always, thanks to the comms team for the brilliant work that they do. It's again going to be critical work in the next few months in order to get the messaging out there and keep the rate of infection down. So I'm looking around the room to see if there's any questions. There don't appear to be any. In which case, I've got future meeting dates are the 19th of November at 8:30, the 26th of November at 8:30, the 3rd of December. Yes, Christmas is coming. Scary, I know. 3rd of December at 8:30, the 10th of December at 8:30, and the 17th of December at 8:30. Hopefully we'll have Christmas Day off, but you never know. You never know. Anyway, those are the future meeting dates. Thank you very much, everyone, for attending today, as always, and thank you for the questions and the reports. I'll see you again next week at the next meeting. Stay safe, everyone. Let's follow the guidance, and together we can beat this virus in North